dedicated session. We have a dedicated session for questions and answers by the end of this session, so feel free to ask anything by the end of that session. Before we start our lecture, please let me introduce you to some of our recent activities in the BSAP-CH. As you may already know, the British Sudanese Association of Pediatric and Child Health is a voluntary non-profit organization that was started by an enthusiastic pediatrician based in the UK and Ireland. The organization promotes development of child health services and support training of Sudanese pediatricians both in Sudan and in the UK. The whole purpose of this organization is to assist members to develop their career and to advance their services. So we have two aspects of work in the BSAP-CH. First of all, for the pediatrician based in Ireland and the UK, we assist those trainees and the newcomers from overseas as well in planning their careers. How we do that? We provide a mentorship and professional advice programs. We provide them with preparatory sessions, interviews and lectures about e-portfolios, ARCP, audit projects, and we help them just to adjust in the new systems like the lecture of today. For the pediatrician in Sudan, the organization works in collaboration with SAP, the Sudanese Association of Pediatricians, to arrange courses and workshops locally in Sudan. For example, recently we are preparing for an advanced life support course, which with the main aim to train the PICU staff in Sudan. We also hold many educational webinars, mid-talk series, journal clubs, and many activities to enhance the learning opportunities of our colleagues in Sudan as well. So this is just a quick glance about our activity in the organization. And some of the events are exclusive for the BSAP-CH members. Other of the events are free for all, like today's event. If you would like to become a part of this big family, please do not hesitate to join us. Our membership is open for everyone and all years around. Now, without a further delay, let me introduce our speaker for today's session on how to master your new workplace. Salma Sadig is a senior clinical fellow in general pediatrics at Royal Preston Hospital. She moved from Sudan to Saudi Arabia to the UK. Her personal experience is an example of how to evolve and fit perfectly in the new workplaces. Salma started her career as a GP overseas and then fitted into a pediatric SHO post in the UK and finally stepped up as a pediatric reg here in the UK. Salma will show us today how she utilized her own skills to fit into new work environment perfectly. So without a further delay, welcome Salma.
Hello, finally I appeared. I was a little bit worried that my appearances will not be possible. I had some technical issue opening my video. Thank you so much for the beautiful introduction. I hope I will deserve these nice words. And thank you so much, all of you, for joining us today. I can see our technical specialist came back. That's why I was opening probably my video. After all of these efforts for my appearance, I don't want to miss that. So IT specialists, please stick around. I'm very thankful for the opportunity that Paediatric Sudanese Association of Child and Pediatric Health organization allow me to speak to you today and to present this humble experience. It was a very sweet story how this lecture was thought of. It was a bit of a small group and we all were discussing how we can make things better and how we can help the newcomers in adjusting and in coping with the new work environment and do the best. I had a lot of positive feedbacks on how this lecture has changed many perspectives for doctors, how they will able to work and cope better in the new work environment. And then the idea become bigger when because basically I'm spread everywhere in Facebook, in many Facebook groups. I'm very sure that many of you are coming from different groups that I am in, and I had advertised for this lecture. So there was many posts of doctors struggling, and it's really simple things. We are going today to discuss how simple it is you can master a new work environment, and it will need the minimum efforts, and you can show your best and reveal all of this stress away. So thank you again, and just to feed back my curiosity, would you mind if you are able to write at the chat? Boran, are the doctors are able to write in the chat at the moment?
Yes,
yeah,
they are.
All right. So would you please feed my curiosity and write in the chat from where you are joining us, from which country you are working, and from which group you saw this advertised for this lecture today. It will be really beneficial for us as the British Sudanese Association Pediatric and Child Health organization to help you in the future and to target the group again with the most interest and the most benefit of this lecture. So some interaction, please. If you write down in the chat, please, where you are working at the moment and from which group you are joining us, it will be really great. Oh, Ashraf Al-Banna, that's my previous boss. That's not fair to know that my previous boss is here. Hello,
Salma.
boss.
Salma, you've got a very nice cocktail, by the way. KSA, Qatar, Sudan.
Oh,
Scotland,
that's so sweet.
UAE.
Oh, that's so sweet. That's so sweet. I'm so delighted of this presence. And I'm really hoping that we will get, you know, the best of the time in the next hour and a half or 2 hours, according to how much you will interact and how much we're going to chat in this lecture. So let's then get started. And may I share? IT man still here, isn't it? Okay. All right, I made it. Okay, good. So first slide. Okay, here we go. Let's start then. So I am not here going to sit and tell you, well, it's easy, it's a piece of cake, and you can master any work environment without any problem. No, it's not. It is difficult. It's not a rocket science at all, but it is difficult. And there would be a lot of tears sometimes. It's not only the ladies, by the way. I know the gentlemen are hiding this, but tears are for all, both genders, doctors, and we see it in both genders, how difficult it is to cope in a new work environment, especially if it's a major change, like moving across countries or working in a different system. But you can do it. I'm here trying to say that you can do it, and it's very simple to be done without stress. Within days you can cope and you can fit in. That's what I'm trying to say, but I will never say that it's a piece of cake. No. So my lecture today is going to discuss a few aspects, how you can work through mastering a new work environment in 5 basic aspects. I'm starting with the social attitude, and then we will discuss the professional attitude, which we will take the most time on it, and then the career development side, and then the teamwork, and last thing is your mental health. So why I started with the social attitude? Because when you start any new work environment, that's the first thing that people see at you, what kind of human you are. And the very first day in any working environment, it's normally induction, it's normally shadowing, it's, you know, usually the very first few days, nothing much, much expected from you. It's usually, you know, the first impression, that's what you want to develop in people and how they will look to you in the next few days. Introduce yourself to new colleagues and keep doing so to all you met newly and ask for their names. I don't know about you, but I am very bad with names. I am very bad. I don't think there is anyone is worse than me with names, but I still manage to do it, even how bad I am with, with the interest in that. When you keep asking people and keep introducing yourself, don't assume that your name is memorizable. You're not like Boran. I bet there is only 2 Boran on the world. I think there is, isn't it, Boran? Is it 2 or 3 in the whole world?
I only met one in my life.
Yeah, so we're not Boran. So don't assume that they will memorize your name. Don't assume that. Introduce yourself. It will make it easy. And then ask about the new name. If I fit an example for that about name introduction, for example, imagine that you are at the nursing station and you wanted to ask about a particular patient. So what normally happens when people don't focus on memorizing names or asking about names? So the doctor will simply say, excuse me, you, excuse me. You can relate to this, isn't it? This is what usually happens. Hey, excuse me, sorry, you, like that. And then he will ask about this patient. But imagine with me, and that's what we are trying to do today, how we can make things better and imagine things to be better. If you went to the nurse station and you are this new doctor, and you introduced yourself, hello, I am Salma Sadig, I'm new registrar working today. I didn't catch your name, sorry, may I have your kind name? And then she will say, for example, I am Sister Asma. And then you will ask her, well, Sister Asma, if you kindly let me know about this patient, did this child manage to, for example, succeed the fluid challenge or so ever? So did you see the difference, how this impression is going to be on this colleague nurse and how she will look at you in the next few days? That's huge. And that's a total different look than if you just say, hey, excuse me, hey, and just, ask her about. So always introduce you, and don't get tired. Even I work in my organization for 8 months and I still checking name up to this date. Until last week, I'm still checking names. Don't ever get, fed of that. Eventually, you will know all of their names and it will make a huge impact. Even if you cannot remember like me, I am very clumsy in names, as I said. However, it will make that nice impact that you are so careful to know this person and address him by his names. And if you have a difficult name, please show your badge as well. It will be helpful. Then after that, join and invite for tea and lunch breaks. Don't just hide alone in the corner and make your own cup of tea. Ask, even if they will say, no, I am fine, no, I am okay. Keep asking, don't give up, and invite, shall we go for lunch? Is it time for lunch? Talk to people, don't just hide in the corner. Share interest, share conversations as much as possible. Common topics like, for example, career development, hobbies, pets. Maintain eye contact when you are speaking, listen with attention. Sometimes the language barrier would be really difficult for some doctors if they are moving, from a different system totally to a different country. It will be, difficult for them to address conversations out of, pure medical terminology. So find out a topic that it's most, relevant and comfort for you, and you can speak freely at, like career development. And that was my favorite one to start conversation with. And when you speak about career development, then you hit, with one stone, 2 birds. You would know better about your specific, specialty in this country and how you can develop. And on the same time, here we go, you made a conversation with someone and you shared an interest, and you developed, a social background with this colleague. So yeah, always don't be scared of opening conversations. It will really make a matter. And as I said, social attitude is the first impression when you get into a new work environment. You are in normally induction, in a shadowing, so no one expected much of a work from you yet, and you want just, you know, to show what kind of human you are and what kind of person you are. Appreciate other work with positive comments. For example, successful procedure, well-managed clinical scenario. Well, pay attention to what I'm trying to say. I don't want to say that we are, you know, by natural jealous humans and we don't, you know, care much about other achievements. But I think when you are stressed, you will be, you know, your own center of attention, and you will have enough problems for your own self to think about and to develop, that it will make you not looking at the others, what they are doing. And, you know, as a result, obviously, you're not going to cheer for them. Cheering for others will literally make a huge impact. You know, I'm very sure each one of you remember when he was in medical school doing rounds with bosses, and then when you step up as foundation doctor, when you step up as SHO, and if you are a reg now looking toward the consultant, positive comments has a huge impact in bounding people. So don't forget this effect. Well, I'm not trying to say be a hypocrite at all. You know, I'm not trying to, you know, advise you to be that person who just, you know, say positive nonsense comment to everything and to everyone in order to gain attention or to gain a social background at all. That is not what I'm trying to say. Sometimes a colleague will really, you know, master a very difficult line, or another colleague will master a very difficult LP. There is things that really worth noted. So cheer for them and give them positive comments, and immediately you will have a bond with this colleague, and it will make a huge impact in your social attitude among your colleagues. Smile, greet, wish for the best, and rest for if the night team is finishing their handover and going home, you know, speak up and say, have a good rest, see you later. Wish them to have a good drive home back. And all of these things, what builds your social attitude and show how kind and how supportive person you are to work with. I love one question that I hear so much: are you okay? It is just delightful to hear when people ask. I cheer for people because I was raised to believe that there is enough sun for everyone, and it's true. Summary for the social attitude in order to master a new work environment: introduce yourself to new colleagues, keep doing so every time you meet newly persons. Try to address your colleagues, the nurse staffing, everyone with their name. If you forgot, if you're clumsy in names like me, keep asking. Join, invite for tea, a lunch break. Don't sit alone. Share interest and conversation as much as possible. Topics that you feel comfortable with. If you are not comfortable speaking about hobbies or pets, speak about career development. Appreciate other work with positive comments to make that nice social bond and see how supportive person you are, noticing others' achievements. Smile and greet, wish for the best, and rest. So this would be the end of our social tips today to master a new work environment. I think we are going very well with the time. We can take one question if anyone has any question in the social attitude. Do you see, Iman, any question in the chat about social attitude? Any comments? Anyone wants to add anything, please raise your hands and we will give him the opportunity to speak.
All right. Come on, people are waiting for you. Nothing in the chat so far.
Any question about social attitude? Any comments, any suggestions from what I already said?
I have a tiny comment, Salma,
Yeah.
if you allow me.
Mhm.
When I first come to this country, when they ask me, "Are you all right, Buran?" in the middle of the corridor, I said, "Yes, I'm okay. What do you think?" So I was really very apprehensive about it at the beginning because I thought it's
Yeah.
something that it may mean that I look tired, I look unwell, I look like not sure
Yeah.
of what I'm doing. But I just, for the newcomers to the UK, they should know that it's just a way of greeting. It's like,
Yes.
"Kefak, how are you?" It's just
Kindness. Yeah, it's a very kind question.
yeah.
Are you okay? Checking on you and asking if you need anything in general. And you know, sometimes it's asked just on the run, you know, and this person is not really waiting for you to tell you to tell him the story of your life or how was your whole day is. It's a matter, you know, of gesture showing, you know, care in a quick way. Sometimes it will be on the run, you know, you will meet in the corridor, both of you are running, maybe holding blood samples or something. Are you okay? Yes, I am okay. And then everyone will go in his ward. So it's just, it's a very lovely question. It's like, you know, showing so much interest and care. I love it so much. And I do plenty of it actually. Yeah, so I think we can move then to the next slide.
Maha Ajabna has a question on the chat. She's saying many people are a bit shy to introduce themselves. How can a person overcome the shyness?
Well, shyness in the beginning, it is totally natural. And I think no matter how, you know, how brave and how outstanding you are, you will still have, you know, some holding backs and some shyness in your personality. Just push for it. Just you know, try to do it. And every time, because we will go through different work environments, if it's not, you know, in the initial stage when we come here, maybe during the training when we move from place to place. So you will be always, you know, meeting new people. Even with new juniors, they are, you know, shifting around every 6 months, they will change. You will always have new persons to practice that. So I would say the answer is just go for it, and every time you will find yourself doing it better. So let's move for the next slide then. What can affect your good social attitude? Taking outside problems to work, this is one thing. And you know, it's very common when you move to a new country, a new system, to have other issues to deal at home, like your renting, your, you know, you're buying a new car, your kids at school, a lot of things going outside, just too much. So just to overcome this, just make sure that you have an initial shadow induction period, maybe you know, less out of hours, daytime working. Ask for it and speak to your supervisor until you completely settle, because it's very difficult, you know, to take all of that pressure to the work environment and to think about everything else and everything inside both of them. That's just too much. Frame yourself in that shy, withdrawn newcomers, you know, who just sit in the corner, drink his own tea and has his own lunch. Don't frame yourself in that person, and just open up. And as the Dr. Maha asked, how I can do it if I am really shy, just push for it, and every time you will do it better. Start with a hello. Next time, hello, are you okay? Maybe the very next time, hello, shall we make a cup of tea? And then it will become better and better every time. Yeah, that's very important. I'm going to open my video for this because I need my eyes. Restrict yourself to oversee colleagues. Be a good colleague for everyone. And that's exactly what I did. I had the most sweet Sudanese colleagues in my very first job. They were super supportive and I was super lucky. But when I thought about it again, it wasn't right. I shouldn't restrict myself to certain colleagues and to make a barrier with the others and just hide behind overseas colleague. Try to be a good colleague for everyone. Open up. I know it's difficult and it's very easy, to stick with your overseas colleague, especially if it's from the same country. Well, that's another story. So just try to avoid this. I know it is unavoidable in the beginning, but just try as much as possible, to also be a good colleague for others by greeting and by, chatting and having short conversations, and don't completely strict. I was very, very lucky. I had a huge support, and I don't think I will overcome that period where, if it's not my overseas fellows, which has to be come to be Sudanese as well. However, when I thought about it again, if I will do it again, I will open up and I will speak to other colleagues, and I will have more social and wider circle than I had when I started initially. Build up different scenarios toward formulating imaginary enemies. We're going to speak about that in the mental health, but just social wise, don't have enemies. Enemies does not exist, basically. It is just, how people are they are born this way. There is nice and kind people, and there is people who are not, but there is no enemies. So don't imagine enemies, and don't block socially anyone. You need to have a good social attitude with everyone, and if it's not possible, just stay away and don't show something negative from social wise. And we will speak about that more in the mental health. Is that okay? So shall we move? That was our first advices with the social attitude. So let's move to the next one, which will take the longer time. It's the professional attitude and how you can professionally master a new work environment. We are a pediatric association, but this lecture does not target a certain specialty, does not target a certain grade. It's not for SHOs only or Reg. It's not for pediatrician. It's basically for everyone. So I would be really delightful if you feed my curiosity again and write in the chat which specialty you are joining us from. Let me see, is the majority is pediatricians, or there is other specialty will force us out. So is everyone allowed still to write in the chat, Boran and Iman?
Yeah, everyone is allowed. Yeah.
All right, so which specialty? I can see pediatric with a flower indeed. We are the flowery specialty. Who else? Pediatrics still. Pediatric, no orthopedic, no surgeons, none. Pediatric still. All right, I nearly give up here. I am giving up. I think I am. Oh, we have a GB. I was a GB. I was a GB in Saudi Arabia. I love GB. They are sweet. Obstetric and gynecology. Finally, we have someone. Pediatrics again. If you did not show yourself, I will move this to pediatric, totally pediatric lecture then. Is that the case? Show yourself. Where is the surgeons? No surgeons? LOLZ. I don't know that.
It's a lot, LOLs. I think so.
I thought it's something I never heard of. And you may be rare specialty about lower something, upper something. Still pediatrics.
GP.
We are officially moving this to pediatric lecture, everybody. Unless surgeons move up. No, still pediatric. All right, we are officially pediatric lecture. So professional attitude, if any surgeon show, just let me know. how professionally you can master a new work environment. And now we are going to speak more about, you know, what you do as a doctor. And that's, you know, I'm very happy that the audience are now increasing, because that's, I feel, one of the most aspects to speak with, and how to master a new work environment with the best professional attitude. So, if anything that is required from you as a new doctor, if anything that you have to do and you are obligated to address in the very first hours, I'm not saying even the first day in your job, in the very first hour, is safety. So safety is first. Remember, checking patients' names when you know, do any procedure, when you take any blood, when you give any medicine, when you prescribe any medicine. Check the allergy, the red flag in the history and examination. I'm very sure that each one of you, I know that most of you are pediatricians, and you know, in pediatric, the red flag is sepsis, basically childhood lethargy, and so on. So for other specialties, I'm very sure that each one of you has something that is his most fear in this patient. Orthopedic, I want to make sure that this leg pain is not septic arthritis. For example, we have an OB/GYN doctor. I want to make sure that this teen doesn't have a ruptured ectopic pregnancy, for example. And I know that there is no surgeons around, but for abdo pain, they want to make sure that there is no appendicitis, or there is no torsion or so ever. So always assume the worst when you see any patient as a junior or even as a senior. So this is a reminder for everyone, basically. It's not targeting any grade. And, you know, make sure that this most serious diagnosis is not in your patient. Don't discharge any patient until you make sure that all of the red flags are excluded safely. Double check medications. Nurses are really good in this normally, but make it a habit. Check your own and double check again, go back and calculate the dose again and make sure that you prescribe the right thing. And that is the only thing. I remember this with a conversation in my very first registrar job. I was very anxious, and I remember my supervisor, when we had the chat, she said, just be a safe registrar, and then you know, work or anything else. That's the most important thing. Go back to your consultants, go back to the guidelines and ask if you are not sure about anything, and don't do adventures. Adventures doesn't apply in medicine. Any other specialty can do any adventures that we want, but as a doctors, we are forbidden from adventures. We need to follow protocol, guidelines, advices, and be as much safe doctors as we can. Leadership. So leadership is, you know, mostly very taken wrongly, the perspective of leadership. Most doctors think, oh, it's for seniors, for registrars, for consultants. I believe that each member of the medical team can express good leadership. And my proof for that, that leadership is even in most of the ST1 application. When you apply to the training for the very first year, they will ask you to express leadership. That means it is requirement for even a foundation-based, you know, doctor, even a foundation grade doctor. Leadership means that you will guide, that you will have a vision how to improve your work environment. You will have a clear goals. You will have some solutions to the problems. You will have the best communication with your team. Leadership is not only for seniors, it's for everyone. So I know that this will come with time, because we spoke about social part. It is something that you need to show from day one. Leadership comes with time. Don't rush into it. Develop the confidence with safety practice. I try my best, you know, to make it a staging presentation where what needs to happen most, and then the most. After you express how safe doctor you are, the next step is to spread that out, to spread that shine around you, to start giving solutions. Leadership could be something as simple as, for example, if the morning handover is too late and we are finishing at 3, for example. So leadership is something like suggesting, having one handover at 4 rather than having 2. For example, it could be as simple as that, just a suggestion, something you think of, not to waste time, for example. It could be allocating roles between you. So after the word round, you are 3, 4 SHOs, allocating roles. Are you happy with this? I am happy with that. Shall we work on this and then gather together to see what we can, catch? Asking others to, get along at the computer to work on the handover sheet. Shall we go through the list, fellows? There is anything we need to be done? Is asking questions like this and searching for solutions and have a clear vision for the day. This is what leadership is, and no matter what grade, even a foundation doctor is needed to express some leadership. Documentation. So documentation is for a lot of aspects, many things. Patient care. In order to care for this patient safely and effectively, we need clear documentation and clear notes. So the next member in the next in the next ward round, will have everything he needs from this patient. We don't need to ask again the same questions. We don't need to go through things again. If things is clearly documented, this will facilitate the best patient care. Documentation also is for safety, documenting an allergy, documenting similar situation. For difficult cases, I know I don't want to, as I said, I don't want to move it to a pediatric lecture here. Things like safeguarding and those important things, documentation is matter, and this is what people will rely on when they are discussing in a strategy meeting or so ever. So don't be shy with documentation. Write down everything about the history in an organized way. Write down about your examination. Document everything that you have done, and don't write, short notes. I don't like saying, for example, normal, heart, neuro, examination and abdomen. I like to specify the abdomen at least with 2 to 3 words. I'm not going to, what was that book name, Buran and Iman, if you can remember, for the clinical exam? Is that Mark book? I think it's called Mark. So I'm not trying to say don't write down the examination approach in abdomen examination for a whole page again, but at least, some details. The abdomen was soft, the bowel sounds was normal and easily audible, and stuff like this, rather than saying NAD. Some people even don't write normal, they will write just NAD. So try just to avoid that sort of documentation and professionally document effectively in the patient notes for the patient safety. And there is a very important aspect as well. It is true that there is medical legal issues, and the documentation is your only way out. If you did something good, and if you discharge this patient in a in non-concerning situation, and everything was fine, document that, because if everything did not go as we wish, then documentation would be your only proof of your good work. So it's very important everywhere you work. We're not speaking about a certain organization or specialty here. Another important thing, documentation, is very important for following situations. If a condition, for example, repeated several times, like immunodeficiency, for example, in autoimmune, connective tissue, how this going to be find out only by documentation, each presentation, what happened and what the examination was, and details like rashes or fevers and this stuff. So it is also important for future diagnosis and revealing rare issues. Next thing is, I know it's not that, matter, but you will not believe that people notice this and it will make an impression on others, especially if this was in your very first, days at your work. Phone is for breaks, unless it is super necessary and you really have something you need to be on the phone for. Chat and side talks when it's possible. I know in the social attitude, I advise you to make conversations. I advise you to make side talks and speak about hobbies, but not when there is, a list of jobs to be done. None when it's really busy. You cannot just sit and chat about bits and there is a few cannulas and jobs to be done. So yeah, try to avoid that. That's another professional aspect. When we need something to do, we have to work, and then if we don't, chill and speak to people or sit in your phone or so ever. Just be careful of doing it when it's really busy. Come on time, leave on time, unless permission taken. Also, these things are really noted. Dress as per code, smell nice, and don't save any efforts of wearing nice brands and showing the best outfit. I know codes has different from hospitals. Some of you are allowed to wear formal, and some of you are only allowed for wearing scrubs, medical scrubs. So we are in that stage. So ever just find out the code in your hospital. Make sure to avoid things like jeans and unprofessional, wear, and sporty look. Try, to wear things more formal at the work environment. Professional attitude, avoid gossips. I need the video for this one again. So because I was preparing this lecture and I was Google searching pictures for it, and suddenly in the chat, when I written gossips, all of the pictures are ladies and misses. I barely, looked for a gentleman for the gossip picture, and I really worked hard to find this picture for a lady and a gentleman doing gossip. So I feel this is, Google discrimination. This is not right. Do you agree, Boran? Why the search for gossip only showing ladies? It's like 90 or 95%. This is not right at all. And this is what is in real life. I don't know what do you think, ladies in the chat? Is that right? Are we 95% in Google search the gossiping picture? Is that right, ladies? What do you think, Boran?
Well, I wrote in the chat, they gossip loads, the males. I mean, maybe it used to be in the older times, but they gossip. They do lots in the work environment.
Well, I strongly disagree. I really worked hard to find this picture. Gossip is for everyone. Everyone do gossip. So the advice is not only for ladies. Please avoid gossips and speaking about others, no matter of good, or bad it is. Even if it sounds, harmless, it's really unprofessional. Just don't do it. Don't get involved in a gossip, talk, and avoid politics. For doctors and friends who knows me, I am, drowning in politics, but in my personal page, not professionally, not in a work environment. No, this is not accepted at all. Try to avoid this. Have a solid ethical awareness and respect people's choices, you know, in a different system, in a different countries. This aspect is totally different from where you come from. So have a very, very strong, solid ethical awareness, read about it and respect people, you know, choices. There is a very nice course called Equality and Diversity. You can have it in e-learning for NHS when you join here. Respect other privacy and keep yours. You know, don't stick your nose in things that you're not supposed to ask about or know about. And I feel this slide is a huge part of the professional attitude. I don't know, what do you think, Iman, about this slide?
Well, it's on spot, to be honest. I think part of being professional is just to avoid politics and only contribute when you're asked for it and when you're sure about your opinion. So it's 100% on spot.
Okay, perfect. And I think we are getting toward the end of the professional attitude. Yes. So we are going to summarize now the professional attitude. And meanwhile, if you have any question, please post it in the chat. We can have one or two before we move to the next slide. I think we are doing well with the time, are we, Iman? We are just toward the end of the first hour. So I think we are going fine. We can take one or two questions. So if you have any question about professional or social attitude, pop it in the chat and we will try to answer together. So just to sum up, safety is first. Remember checking names, double check medicine, red flags in any history, keep high leadership awareness and action, documentation, phone is for breaks unless it's necessary, come on time, leave on time unless permission taken, dress bare code, smell nice, ask for help and advice, don't do adventures. We don't do adventures as doctors, avoid politics and gossip, and that's for ladies and gentlemen, I insist, and respect other privacy and keep yours. Any questions in the chat?
Yeah,
Ladies?
Maha is having a question. She's saying, just a minute. In politics, is the country, do you mean the country politics or the workplace hospital politics?
Well, I would say both. Why not? I would say both. Avoid the troubles as much as you can. You are a newcomer and you don't want to start with trouble. So whatever getting you into trouble, just avoid it. I would say both for this question. Any other question or shall we move?
Maha is having a second question. How to tackle if two consultants are at odds and this makes the junior uncomfortable?
It really depends on what is your position in this, you know, situation. If you are truly affected, you need to speak up. You know, the people to speak up with would be the supervisor of yours, and maybe had a chat with each one of, you know, them aside that you feel, you know, uncomfortable in this situation, and you know, you really wish for you know, advices how you can overcome this. I think being honest and open, you know, will save you a lot of you know, dilemma. Just don't keep quiet about it. Speak up about it to your supervisor or to each one of them separately, and then I feel that's will solve things out. I believe our boss Hani is raising his hand, unless it's by accident.
No, it's not by accident.
Go for it.
It's a very excuse me, very nice advice and very nice presentation so far. I disagree with few of your opinions, especially the last one about politics and gossip. You have to choose who to gossip with. This is one. Gossip is different. Gossip doesn't always mean you are biting, you know, you're backbiting. It doesn't mean that you're always talking about badly about people in their absence. Gossip can be about anything. You know, as juniors, we gossip about consultants. This is normal. This will never end in medical profession. You just have to be careful who to gossip with. That's one. And what kind of topics you talk about. You know, you can talk that someone is really rough, someone is really tough, he's not nice, he's not doing this to us, he's not a good person, you know, to do assessments with and all that. This is gossip because you're talking behind their backs, but you're not saying anything that is, let's say, offensive. Okay. So you're not talking about their choices, but you're talking about how they are interacting with others. So you have to just be careful about who to gossip with, and the word gossip also, we need to change it probably to something else, let's say. The other thing is about politics. It is very good to talk about politics, but you can't talk about politics, you know, in the middle of the world round or in the, while you are still, you know, doing your jobs and looking for you know, x-rays and doing the, you know, chasing bloods for patients or taking histories and all that. But if you are sat in the doctor's mess, you know, if you are having a cup of tea away from the ward, if you are walking in the corridors, we talk about politics every day. I talk about politics with consultants. I talk about them with my, you know, registrar colleagues or with juniors, even SHOs, with anyone. I talk about it because when we are sat in the mess, you put on the BBC News and it is something relative, related to what you are doing every day in your life or in hospital. We definitely talk about it, but it's also about, you know, you need to know how to talk about it. Talking about politics here, I don't want to take the time, but talking about politics here is not like talking about it in the Gulf region, where, you know, you are not allowed to mention about, you know, the king or the crown prince or you know, the royal family or something like that. Even the royal family here are mentioned in the news every day. Their life is not private. Everyone talks about them. So there are no barriers, but you have to be respectful. You have to be mindful of other people's opinions. So you are entitled to your own opinion. You should not undermine other people, and you should not prevent people from saying their opinions. So this is just my opinion, Selma. It's different from yours, and this is was my experience here. It didn't cause any problems to me. It was actually even better. You can sometimes open conversations with people with these topics and all that. That was just a side comment.
Thank you so much, Hani. I think in a large way, we you know, end in the same page. What I'm trying to say is, let me clarify these 2 points again, gossip and politics. When I was saying gossip, I didn't mean feedback and discussing performance of juniors as a registrar or discussing performance of registrar as a consultant, because this is, you know, very important part of our job, and this is part of the leadership that I was speaking about. As a registrar and a leader, you are required to point to the consultant who is the SHO who's working really well, and who's the SHO who needs improvement in particular point. That's part of the leadership that you need to show when you start a new work environment. I meant by gossip is side talking about people, not in a good way, obviously, because I advised in the previous slide to cheer for people achievements and to encourage people and positive talk, you know, about them, either from their front or their back. I don't think anyone will mind if I say, oh, that SHO worked with me that night and he was brilliant, or she was brilliant, she was really initiative, she was really working very well. I don't think anyone will mind saying this behind his back. What I meant is talking negatively about people, not with the aim of a feedback, just for a gossip and just complaining, you know, like just side talking with someone. Oh, he's terrible. Oh, I had the worst night with him. He wasn't working well and something like that. He wasn't supportive. And it's not I didn't meant with the aim of feedback, because feedback is something required from us as a leader, as a registrar, to feedback for your SHOs, and as an SHO to feedback from F1, you need to feedback, and that's part of the leadership. And this is not what I meant by gossip at all. I meant bad talking about people behind their back. And I don't believe, if you think, I don't think, you know, you meant that this is okay. I strongly feel that you meant mainly the feedback. And I do agree with you that we need to feedback, but again, in a professional way. So, for example, if I am concerning about an SHO working with me as a registrar, why I would feedback to another colleague who wouldn't, you know, be involved in his improvements. I need to feedback to his supervisor. So when it's bad talk, when it's negative feedback to the right person, to his supervisor, it's not gossip anymore. It's a leadership. It's called the leadership now when you express concerns. And even with that point, I still, you know, have some holds back. Why not speaking to him first? Why starting with speaking with the supervisor? You're the leader yourself, and you are responsible for this junior. So why not having a chat with him and expressing your concerns and allowing him to improve before jumping to the negative feedback to the supervisor? I'm very thankful that you allow me to clarify this, but what I meant by gossip is basically that what has happened in the normal life and in the work environment. Sometimes, you know, unnaturally we complain and we roll eyes and we speak about people. You know, oh, I had the worst night. Oh, he was on his phone. For example, the things that I have advised not to do. Oh, this is always on his phone and things like that. This is not, I don't think this is, you know, something you would advise. I strongly feel that you meant the feedback, and the feedback, if it's negative, it should be to the right person. Negative feedback is not for everyone. It should be for the right person, either the one with the negative feedback himself to improve, or either to his supervisor. And in terms of positive feedback, I didn't mean that at all, because I advise to cheer for people. And I don't think if I said something positive about person behind his back, he will get angry at all. Moving to the next part is that you don't agree with me is politics. So how many years you are here, Hani? How many years you are here? Is it 5, 7? I believe you hit it 8 or something. I remember a long time ago when we celebrated your GMC in the Saudi group. I do remember that. And you were one of my, you know, inspiration to. I was looking after people like you to come here and achieve what you did. It's been a long time, Hani. I am targeting this lecture to the new coming, someone who comes fresh the very first few days in his work environment. I strongly disagree with you, Hani, that it will make the other colleagues comfortable for these newcomers who just came yesterday and speaking already about my leader and speaking already about my government. No, I don't think this is advice at all. It could be after 5 or 6 years, you know, when you get into the shoes and you become that cool senior consultant as yourself, well, that will be a different thing. But for the very first few days, I don't think, if I am someone from any country, I'm not speaking about any country or organization, I will be delightful or happy with these newcomers who are speaking about my leaders. But anyway, there is no right or wrong way here. We are here to chat and see how people can make things better. So I'm very happy that, you know, give us your vote today. And if anyone else from the British Sudanese Association of Child and Pediatric Health, if anyone else from the seniors are here today to chat with us and give us comments or advices so far, I will be really delightful, like our boss Hani did.
Salma, I think I can say a couple of words. I think I'm in a place halfway between you and Hani. So especially in where we are, language barriers are a huge part of our daily struggle. So many words I found myself saying very confidently have many other means apprehended and translated in other ways by others. So unless you are really very sure that you master your language very well, I do not recommend anybody to enroll into gossips or politics here. Try to be mindful, at least till you are very senior, at least till you know really well who you are speaking to. And actually, gossips in any means, and in any language, it isn't a good behavior. So try to stay away from that. And in my 5 years here in NHS, I haven't at all seen anybody speaking about politics, to be honest. Maybe because I'm not that kind of a person. I'm very superficial in relations with others. I just mainly smiles and highs and buys, but I wouldn't do that. I'm very watchful for my language. And as I said, some people sometimes translate simple words into some stuff that you never meant to say. So I just stay away from it.
Yeah, I just feel it is hard, in the very first few days or very first few months when you try, barely to fit in and get into the shoes, and try to formulate to people what kind of doctor you are. Basics is the basics. Start with good work and show what kind of good doctor you are, and then, everything else will be secondary. That's, how I personally feel. I see a few questions in the chat. I think we can take one of them about dress code.
Reem, she asked about the dress code. She said, if we have to wear a scrub, is there any specific color for each hospital? Because I wear hijab and I want to bring scrubs from Saudi Arabia. From my experience or the hospital that I work in, Reem, the medical team wears blue, but you don't have to wear them. If you want to bring your own scrubs, then that's fine. I bring my pink and purple scrubs from home, as long as you wear them in hospital and then you change when you leave work, and that's it. We don't have a strict color code for the scrubs. How about you, Salma, your hospital?
Yeah, so I think it's really, different from place to place, what they are emphasizing on and what are the things they are okay with. So in one of the hospitals I worked with, it was totally fine to come with a trouser from outside, a black one, and then just wear the top scrub, and work your way out again with the same, bottom. So in some of the hospitals, this is not accepted, and you should change the whole, outfit inside the hospitals and change it all in order to go back. So it's really difficult what they are emphasizing and focusing on. So try, to figure out in your hospital, have a chat with your, colleagues. It doesn't need a supervisor or a manager or, to find out those things, because sometimes what is written in the dress code is totally different of what's actually happening on the ward. So just, I would advise to ask your colleagues if it's okay to do that, if it's okay to wear that, and you will find the answer. Hello, Reem, my previous colleague in Saudi Arabia. I am very delightful of the presence of Reem and Dr. Ashraf today, my previous boss. Let's move to the next slide. Do you agree, everyone? Okay, so work and develop your career. Don't just work. Don't just drag your legs to the duty shift, looking toward the end of it in order to go back home. We are spending about a third of our young life at work. So, it's a lot of, if you calculate it in years, it will be years of your age. So make it worth it. Don't make it just, a job to finish and drag your legs toward the end of the duty. Don't delay plans as well. Don't delay plans. I always, why I put the picture of the good doctor. I was so fascinated by this TV show, how good he was and how, brilliant and the way how he bring up, diagnosis and differentials, the way he do things as a brilliant surgeon. That's why I love surgeon. You can tell, looking for surgeons in the group. So who watched this show? Is anyone in the chat watching this show? Do you watch it, Boran? Do you watch The Good Doctor? Iman?
I've seen a couple of episodes, but then it was too much for me.
The Good Doctor is so sweet show, and it just, you know, fascinates me how good I really wanted to be. I wanted to be that good one day. I'm not autistic, but, you know, I wanted to be that good, to have this ability, you know, to help and to be a brilliant doctor. So have that passion in your colleague. Third of your life is spent at the work environment, and it's a lot, third of your young life. The best of your life is spent at the duty. So make the best of those hours to develop, and just don't go for duty every day. So in order to have a good career development, acknowledge your weaknesses. That's the first step, to start humble. What's a step, you know, stopping me from moving forward and getting better? Is it spelling? That was, you know, and it could be a little bit one of my problems. Could it be communication? Luckily, I was happy with that. So I worked on the things that I was weak with. Is it knowledge? Do you think you need more knowledge in your specialty that you're moving in? Do you feel less knowledgeable than the others? Address. And if you don't start that humble, you know, if you don't start realizing what is your weakness, you will not move forward. That's the first step, to acknowledge and accept what I am lacking in order to be better. Okay, and work of them, put a plan every day. Consistency is way better than huge steps. Don't say I will wait for the summer holiday in order to get into a course, in order to examine part 1. No, consistency. Every day read a topic, every day working on a procedure that you find it difficult. And we know the procedure pain in pediatric, don't we? It's a lot of pain. Oh my God. So work on procedures, skills, communication. That's the thing, that make a goal for every month. This month is for cannulation, and I'm going to master every single cannulation I'm going for this month. Next month is for knowledge. I want to develop my knowledge on that and this, and have this attitude of continuous development and passion to be better. You know, not necessarily like Dr. Murphy, because he has a special, you know, condition makes him memorizing books, but as close as you can be, as close, as good as he does. Be familiar with the guidelines and how to find them. Apply always in your practice, even if you are a senior, most genius consultant, as Dr. Hani, our boss today, you still, I'm very sure that he goes back to the guidelines. I'm very sure that he always checks the latest guidelines in treating his patients. So no matter, it doesn't matter, don't think that this is something will underestimate you and will make people think different about you. Relying on the guidelines make you a better doctor and gives better care for your patient. Show the desire to learn. In skills and plans, be humble to learn from others and observe. Don't have the attitude that I know better than you, and you know, I don't need this, I don't need to be taught. No, at all. Start as lower in order to rise. You have to have a strong base and be willing to learn from others. If you fail a procedure, go with the colleague, with the senior who will do it, in order to learn how to do it next time better. Be ready to learn and absorb from people so you can give one day. Develop your knowledge, one topic every week. As I said, consistency is better than big plan. Don't wait when you have annual leave. I'm going to read about that. I'm going to prepare for the exam. No, have each topic just once every week, not even a day. I'm not saying a day, just a week, and see how difference is going to make in your practice. smart handover using SBAR. I know we are using this in pediatric, but I'm very sure that it does exist, or somehow maybe in a different, terminology in every specialty. Smart handover is not only for the morning or the evening handover. It's actually whenever you are speaking about the patient. That's true. For example, you received as a junior, new junior coming overseas, and you received, for example, a bleep referral, and you want to discuss it with your registrar. So don't go, I will not put a pediatric example anymore. I don't want to make this a pediatric lecture. So let's say you are orthopedic SHO and you want to discuss this referral with your senior. So SBAR is situation, the patient that present with, background, assessment, and then recommendation. So you will start with what's this patient presented with. I received a referral for this 5-year-old who's not able to wait beer, for example, for 3 days and increasing progressively. He has temperature. The GB found his, for example, right hip painful. And then on his background, he's normally fit and well child, no previous hospital or orthopedic problem whatsoever. I'm not an orthopedic doctor, so please don't laugh at me if I say anything stupid about it. I'm just trying, to address the perspective of it. And then on the GB assessment, there was reduced moving in the internal and external rotation. You have a lot of odd stuff in orthopedic, let me tell you that. I'm happy I'm not yours. Internal, external rotation, flexion, eversion, something. You have a lot of difficult terminology. So this is what's happening. And then the recommendation of the GB was that this is possibly, septic arthritis, and this child needs to be seen. That's the way you want to speak to people about every single patient, not only in the morning handover. Another example is if you are referring. So we put an example about accepting referral. Why not we make it as you are referring? Again, when you speak about, let's do it as a surgery doctor now. So you want to refer this patient because he's only 3-year-old and appendicitis will be done only in the tertiary hospital. You are a district hospital. You don't do appendicitis below 3-year-old. So you will speak the same. So I am speaking about a 2-year-old who has severe abdo pain, started since 3 days. It was central, moved lateral. Please don't test me on my surgical stuff again. I am a pediatrician. And then on the background, he's a fit child, no previous surgical problems, not known to have abdo pain before. And then on the assessment, I found him to be tender on the right iliac fossa, and it's very painful to flex his right hip. And on my recommendation, we think that this child highly suspected appendicitis, and we recommend that he will refer to you. So this is the way you want to speak about patient with anyone, no matter if it was a bleep, or it was a referral, or it was a referral letter, or it was in the morning handover, or even in the daily assessment. If your registrar asks you to go and assess this child on the ward, he's been admitted. He's admitted since years, but still you want to speak to him with your assessment. Try to use the SBAR. It will make you, look different and be, efficient handover as well. Not only the look, we are not, trying just to glamour the look. We are trying also to work right, to do the right thing. Frame a history and examination in order to have good time management. When you come as a new doctor to a new work environment, you are stressful, you want to, show the best of you. And sometimes you just rush, you don't want to, show that you are slow. Maybe there is a lot of pressure. So it's very nice to practice a frame of history, no matter what your specialty is. As a pediatrician, there is things in my head that, I go through very, very quickly, like birth, how many times he passed urine. It's a very odd question for medicine for adults people, isn't it? But we are really, emphasizing some our own questions. So have your own frame as an orthopedic doctor, as a surgeon doctor, 1, 2, 3 things that you want to go through in the history to have the best time management, and it will come with time. It's okay to spend 40 minutes or half an hour in the first few shifts, and then after that you will have the ideal time, which we know with each patient, I believe it's about 10 to 15 minute consultation. It depends really. So it will come with time. Don't worry about it at all. Just have your frame, have your red flag. Remember red flags again. What is your biggest fear as orthopedics? Make sure that it's not septic arthritis. As a surgeon, it's not appendicitis, and so. Plan your exams, your training, your next step. Don't just, wait for it and sit for it. Planning is very important, especially for applying to the training. And it's a personal, thing for me as well. The lack of planning didn't made me through the training, unfortunately, twice. So I am advising you from a very strong personal, experience. Don't say that it will come in month 11, in 8 or 9 months. Plan it for today. From today, start working on what you need in order to get into the training specialty that you want, or the next step. From the very first days that you step in and start working, think about it. So in order to summarize now our tips in order to develop and improve your career and be similar as much to Dr. Murphy, be familiar with the guidelines and how to find them, apply always in your practice, even if you are senior doctor working here for some time like Iman. I'm very sure she still relies on opening the guideline every time. Show the desire to learn, be humble in order to learn from others, observe how they are doing things, and then the next time you can do it and show it to people. It's very important to start low in order to raise. It's very important to have a base. If you want to build a high building, it's very important to have a strong base, and that's similar as developing your career. Develop your knowledge topics every week. It will make a difference. Acknowledge your weakness and start working on them. For example, as skills, as spelling, as communication, as a procedure. What is stopping you from shining and being better? And make a plan working on them. Speak to your supervisor and make a timeline of what you want to achieve in the next few months or weeks. Smart handover. Plan your exam, your training, your next step. Have a frame for history and examination to have good time management. So that was my advices in order to develop your career. Anyone wants to add or ask anything about career development, professional attitude, or social attitude? If you can pick up some question from the chat for us, Iman. Any questions at all? Or anyone wants to add anything? Is the boss still around? Dr.
Muhammad Usman is one of the bosses, and
please speak up.
He said, just know the personal specification very well for the training you are applying to and work on it, and always ask for a feedback, which is a really valid advice.
Yes, yeah, it is realized by me very late, but lucky you, Dr. Muhammad now giving you the things earlier. And I believe for pediatric, it's few months ahead. So all of the blessing for all of us and for all of the other specialty. Be aware when is the application time is and work on it from today. Any other question? Anything else, Iman, or shall we move?
Nothing on the chat so far. I think you can move.
Okay. Okay, so next thing is team working. And remember what we said in the beginning of the lecture. It is not, I'm not here just coming to say, oh, it's a piece of cake, just work with the team and just go for it. No, it is hard, especially when you are new to a new work environment. It is difficult to blend in, but again, I am not here going to say it's a piece of cake. I am here saying you can do it, and it's as simple as you never thought it is. So simply, you know, how people will know, how they would know if you did not show it or speak about it. It's not only about action. Teamwork is also about, you know, communication and vocabulary, and, you know, just simply asking others if you need any help. I feel this is all, you know, considered part of the teamwork and being initiative toward helping and toward blending into your team. So ask your colleagues if they need help when you finish your job list. It is very, you know, easy in a busy day when you finish your job list just to set aside, maybe opening the phone, you know, going through WhatsApp or Facebook. I know it is very easy to do that, but remember, this lecture is all about, you know, setting your first impression and fitting in a new environment. So ask others. If you finish early, ask others and be initiative. Are you okay with your jobs? Is there anything you want me to help and, you know, assess you doing it? Check if they have their breaks, and have yours. That's very important. Take turns in going for lunch. If you are a group of SHO, ask them, do you want to go for your lunch? And then when you come back, I will go for mine. Inform others when you leave. Don't just disappear. Tell them where you're going. I'm going for the canteen, for example, for half an hour break. And then I will come back, you can have yours, or something like that. Try to swap when it is possible for the rota gaps. And again, it's very easy, you know, to get into that pressure of saying yes to the rota gap constantly in order to prove something. You're not proving anything, you know, believe me. You're just going to pressure yourself. So if it is possible, when it's okay and it's not pressuring you, swap for the rota gaps and help out. It will be counted. Help juniors if they are struggling. Leadership is not about orders and distributing jobs. If you are a registrar, check on your juniors if they are okay, if they need any help. Step down for their jobs like discharging letters or speaking and referring or taking the bleed. If you feel your SHO is really struggling to rest, you know, if you don't have the reg bleed, for example, you can offer to have his for half an hour. Things like that, you know, will show how good team member you are. And as I said, how people will know they are not getting into our hearts. They will only know from our actions. If you don't show that you are a good team members, how people will know? So you will show by actions and by questions and by initiative thoughts like this. Be initiative on the ward jobs and nursing concerns. An example for that, if a nurse is asking you if this child is allowed to go home and he's allowed to discharge home, as a junior, you are not allowed to discharge patients as a junior level foundation practice or SHO. It should be, agreed by a senior. So be initiative. Don't just tell her go and ask the reg, or you ask the reg yourself. Why not you go and assess the patient? Go and listen to this patient chest, or go and feel his tummy. What was the problem? The problem is solved or not? What is his vital? Is there any outstanding investigation? Or what was the plan in the ward handover? Maybe the plan already documented and the patient is already for discharge. So be initiative. Don't have that attitude that it's not my job, it's not my issue, and I don't have to worry about this. Be initiative. If a nurse asks you about something and you're not sure, check on the patient, look into the notes, look into the ward round documentation, and then when you ask your reg, you will have the whole picture. You would save him a lot of time. This patient is not wheezy, his chest is clear and his vitals are stable, the patient is drinking, and I can see on the ward round documentation that if he remained well for after evening review, he can go home. Are you happy for me to do the discharge letter and send him home? Imagine the difference between this SHO and another junior who's just coming and say, oh, the nurses just asked me if this patient can go home. Are you happy for him to go home? So it's a huge difference, isn't it? So that's what I mean by being an initiative. Even if you don't know, try to gather some information in order to find out and knowing. Don't take sides. Don't take sides. It's very easy to do. Support all who needs you and ask for support. Again, when you are a newcomer and you were lucky as I was to have people support you, especially if it's from your country. I was very lucky, as I said, I'm very blessed, but be careful if you are in that lucky situation to take side and support only your group and your people. You need to be a good colleague and a good team member for everyone. So just put in your mind not to encircle and tighten your teamwork and your social circle. So I think teamwork is just one slide. If anyone has question or anyone wants to add anything, Boran and Iman, anything to add? Everything okay? All right, let's move then. Okay, say it, document it, or it won't count. How they would know? If you don't say, if you don't document, how people will know? Highlight your achievements, speak out, especially to your supervisor. If you did, for example, your first clear champagne tap LP, if you did a new very difficult cannulation. I am now being a pediatrician, am I? But you didn't give me any choice. I didn't see any other specialties around, only few. So just forgive me of speaking about pediatric a little bit. So highlight your achievements, the good thing that you have done, tell, talk about it, don't just do them in the shadow and they are considered done, whoever done it. Speak about your achievements. And it's a natural thing for most overseas doctors to be shy about speaking about their achievements. So try, to think about it and how important it is, and observe others, the way they speak about their achievement. It's very important, to highlight the good thing and spread, the good news about this good LP or this difficult cannulation. Portfolio is very important, even if you are not a trainee. In every specialty, I believe there will be, a particular way to document and to follow, your competencies and to sign off your competence. In pediatric, we have our e-portfolio Kaizen. In other specialty, I'm very sure you will have something you document your competencies. It doesn't matter if you are a trainee or not. There is, I believe, if I'm not wrong, Boran, there is a few companies that it's open for any doctor or any specialty that you can sign off stuff and you can send off competencies to be signed, no matter what's your, doesn't belong to a particular specialty. I am not being saved by a name now to mention it, but think about it and search for it. You need to have some sort of account. Mostly it will be paid, but believe me, it does worth it. It does worth to document those for your future training and just, for your own satisfaction. We don't want to waste all of these good efforts just, in the air. We need to document them. Chase your supervisor, and I am not kidding by saying chasing. Ask for regular feedback and how to improve. It's very hard, they are very busy, and consultants will have, a lot of responsibilities in their shoulder. So, don't get hurt by, missing some meetings with your supervisor, or you didn't get the enough support. Be initiative and chase for it and ask for it, and don't just cylinder and wait. Smart failure language. you know, it is part of highlighting your achievements, how you speak about yourself and how you represent yourself. If you fail a cannulation, and it's very common in pediatric, it's a nightmare. So if you fail a cannulation, don't say I failed, say it didn't happen this time. I wasn't lucky this time. I didn't do it this time. That's mean I'm doing it regularly, but not this time. So have a very, you know, positive way about speaking yourself. If you are speaking negative about yourself, how you will, you know, expect that people will think and look at you positively if you are yourself negative when you speak about yourself. So always have a smart, fairer language. It didn't happen this time. I didn't made it this time. I am not a failure. Don't say I failed at all. Reflective practice. Oh, this is very, very important. Reflective practice is very, very important way of learning. You know how to. I think it's part of the career development. I don't know how it ends in documentation, but it is, you know, it is part of this, and this gives reflective learning cycle, you know, gives a very good, you know, example of how reflective practice should happen. And it doesn't matter, you know, if you don't have account to document or to reflect, and you know, it can be even in an email for your supervisor, you know, and it will make, you know, a huge difference on his decision. If something major happened, like missing a diagnosis or failing a procedure, or you know, inability to complete a certain task, either to him or to your e-portfolio, describe what happens. And then the next thing, what was your feeling? What was your thinking when this thing or this situation was happening? What was good and bad, analyzing, you know, how you can make sense of things, and why you think this leads to a failure, or why you think this situation ended this way, and then conclusion, how you can make things better, and then act on it, and again reflect on the next time. So stick to the GIPS reflective cycle. It will help you. And there is, you know, many abbreviation and reflection. I'm not here going to specify about particular advice too much, but it's very nice, you know, as part of this lecture, as a new comer, to know what is reflective practice. So I am just giving you the first headline, and go read more about it and see how you can do it. So that was the end of the documentation and teamwork. And the last thing is mental health, the last part of our lecture, unless we have any question or any participation from the previous slide. Any participation at all, or any question? Imam, Boran, are we all right?
We're good so far, Salma. I think you can continue.
Okay, perfect. So we are going to move to the final part of this lecture, which is mental health, how to keep a very fresh, good mental health toward this initial difficult time when you are joining a new job, a new system, how you maintain the best mental health of yours. So, have you seen this guy before? I'm very sure it's very, very common. We've seen them. Sometimes we can be this person, isn't it? This icon sometimes is in our own faces. So bullying and evil do exist. It's a true. It's very nice to remember that it's not about you. Remember in my first slide saying, there is no enemies. There is nothing called enemy co-worker. It's all in the imagination with the stress and when you are building up situation. But bullying does exist and evil does exist in people, sometimes in ourselves. Sometimes you have this mask, this evil mask without even realizing it. So always remember, it is not about you. Maybe this person is going through a difficult situation for himself. Maybe this person is having conflict at his home while coming to work. That's why he's doing this. Maybe this person is being hurt. That's why he's hurting. So remember, it's not about you. You don't deserve this. It's not yourself the reason that bringing up the bullying or evil to yourself. It is not about you. It is about this person or what is he's going through, and this is reflecting out on you. Keep your cognitive cycle healthy and positive. We will speak about the cognitive cycle in a bit, but again, I'm reminding you, always think that it is not about you. This person is behaving this way because he has a reason from his own, background, and it's not about me. I'm not the reason causing this. I am not the person who deserves this, and it's not about me. Don't ever respond to unprofessional behavior unprofessionally. You need to respond in a professional way, no matter how unprofessional was the behavior toward you. Reach out to whom can help you in your organization. Ask about it. Your supervisor, a senior that you find really comfort and supporting to speak with. And there is advisors, different terminology in each trust to maintain a good behavior between colleagues. And it's obligation. Remember, it's obligation for any team member to behave professionally for each member, no matter what his grade is. But just remember, don't behave unprofessionally to unprofessional behavior. You need to be still professional way to respond. And there is many ways. Find out how you can do this in your trust and what is the people who can help you, and start with your supervisor and people who are closest to you as a senior. Ask yourself. So this is something that I could strongly relate to personally. So is it really worth it? I know it is very easy to be a protective personality who responds harsh and strong back. And I remember myself at some point of my life, I was that person who, respond back to any, attack or any unprofessional or anything I could smell that would harm me. I was that person, and believe me, it will just eating you up. Sometimes it just doesn't worth it. Ignore and move away. I found out that my energy when I was responding harsh will be, wasted away, where I can focus on things like my career, like my family. Anger is an energy, that's true. You need energy to be angry more than being happy. So it's easy to I'm telling you, because I was that person. It's very easy to change. I used to be that person you cannot mess with. And when we speak about an African lady, and especially Sudanese, what I am, saying, responding back harsh and banging back whoever who says, anything could annoy me. I used to be that person, but it doesn't worth it. Calm down, respond professionally, respond in a calm way. And sometimes it is just doesn't worth it. There is minors that can move away, that can be forgotten, and you can overcome them. Forgiveness is a very important skill to move in life, and try to live and feel this gift of forgiveness. Sometimes minors are really doesn't worth it. So just don't stop for people for any minor action and run and rush to supervisor and make a statement about it. There is a few things that doesn't just worth it, but unprofessional behaviors needed to be responded back to, remember, in a professional way. Cognitive cycle. Now, please don't think I'm crazy. I am not. Cognitive cycle is something that is used. Is any psychiatrist here? I'm being really, hopeful that we might have a psychiatrist, but I don't think so. So cognitive cycle is something very, very, very important for mental health. And you don't need to be psychiatrist. You don't need to have psychiatric sessions. You don't need to have psychiatric appointment in order to work on your cognitive cycle. You can make it at home. Cognitive cycle always started with thoughts. What are your thoughts? Am I a good doctor? Am I doing well? Am I less than the others? Am I as good as everyone? That's the thoughts that you are implanting in your head when you think negatively, and it will lead to stress feeling. It's a cycle. Remember, if you are thinking negative about yourself, I am less than the others, I am going to mess, I am going to fail this, then you're going to feel stressful about it. It's going to bring you stress and fear, and this will reflect on the way you behave and the way you do things, and the cycle will go on and on and on. But when you have the correct thoughts, you will ask me how I will implement thoughts. Well, thoughts are implemented, you know, for every human being, started from the day that he was born, his tradition, his religion, his beliefs. Those are all thoughts. Is that right? Those are all things implemented through our life, what we are believing, what we are thinking, what kind of food we eat. I still can't believe how people will eat fish eggs, but some of the people are grown up to think that it is something delicious. So it's a thought implemented in their, you know, life journey. Thoughts are very easily, you can do it, and you can implement positive thoughts when you train your mind in front of a mirror or in front of your phone. Come, please don't think I'm crazy. This is real stuff. Talk to yourself, speak to yourself, and change and implement a new positive thoughts. And this will lead to the positive feelings of reveal, and it will reduce the stress, and then it will reflect on your behavior and the way you are going to work and show to others. So cognitive cycle is very important. Read about it. I'm not going, you know, to spend more than this on it, but I just cannot say how magic it is changing people's behavior. Plan your leaves early as possible. Have a diary just to take everything off in your mind in that diary. It is very easy in a new system, in a new work environment, you know, with the rent, with the kids' school, with the issues, you know, it's lots of things. Just have a diary, put them all away off your mind and get on them on time. You have a date to worry about each single thing. So written diary, I prefer written on electronic, honestly, in order to feel things and to sense things and to feel that this date and this event is taken away from your mind to a different, you know, subject, rather than your mind into a diary, if that makes sense. Don't take work with you home. Again, that was an advice in social attitude. Again, in mental attitude, try to cut, you know, the two places apart. Work is at work and home is at home as much as possible. Sleep well and have a physical activity routine. Don't just go home to sleep, as I do most of the days of my life. Have a physical routine, a walk. List the blessing and the problems in your life. You feel the difference. I'm very sure in English, you know, in each single one of you, the blessing will be much way than the problems in your life. If you think about the simplest things that is provided to you for a guarantee, your kids, your breathing without support, you're eating without support, you're walking without an aid, lots of blessing. And if you compare with the problem of your life, it will be a minor. So try to remember those in the difficult time. Many around you are happy to help. Develop a support cycle. Use the paid help with kids. like childminder in order, you know, to have a time off from their little demons and, you know, just to enjoy a cup of tea with a colleague, post school classes, maybe put them away for school for longer time in a few days. And, you know, it will have two effects, you know, they will get benefit, they will get skills. I'm not totally evil here. They will get new skills, they will get more social, they will get more education. And on the same time, you will gain more of yourself and of your mental health. Meal planning. For ladies, I'm not sure about the gentlemen, but this is for the ladies. Meal planning, have a big freezer, plan your meal. There is some companies who can send some bland meal, and try, you know, to take off that some of the stress at home in order to work better, have a better, you know, home environment with less stress to go to. Get a professional help if you cannot cope with it. Have the professional help. And then if you just have done everything what you need to do, and if you reach that point that, okay, I've done everything, or every single advice in this slide I have done, and it's still, you know, difficult, it might be the workplace. It's true that some of the work environment is just not suitable for you. So just, you know, move out and apply for another job. But I just written it in a shy way just at the end, because I don't believe much in it. I don't believe in enemies at work environment. I don't believe that there is any work environment that can be that difficult you can apply out of it, unless you want to develop your career or stepping up. That's a different story. That's why I listed at the end, but it's always an option. Move out. You are not a tree. If you like a place, you can move out. So summary of the mental health: bullying and evil exist even in each single one of you. Remember, it's not about you. You know, you can be as evil as yourself when you're having a bad day, when you're having a conflict, going to work. So remember that this person could be going through something. This person could have a bad day. It's not always about you. It's not always that you, you know, done something or you need to defense about it. Keep your cognitive cycle healthy and positive. Respond professionally to the unprofessional behavior, and be always professional to the most unprofessional responses to you, and reach out to the person you need to speak about, your supervisor, the organization that dealing with people behavior, and speak out in a behavioral way to this person. Ask yourself, is it really worth it? Some of the minors, we just need to ignore them and move out, because it doesn't, you know, worth it. And the energy of being anger and the energy of being, you know, of revenge is way more than the energy that you need to be happy. So just ignore it. Sometimes it doesn't worth it. Remember your goals, why you are here. You own this to yourself. Thousands of dollars and a lot of efforts it was spent in order to move to this new workplace and system. You own this to yourself, so fight for it. Plan your leaves early as possible. Don't take work with you home. Sleep well, have a physical activity routine. List to the blessing and the problems in your life, and when you compare, you will be amazed how much blessing you have and how much tiny is your problems is toward the huge blessing. Many around you are happy to help find your support cycle. Try to find people who can help you with paid, like childminder, like meal planning. So these issues, you know, will help you going to work less stressful if you are having a good mental health at home. Get professional help if you cannot cope. And the last option would be just move out if you cannot cope anymore. Thank you so much, all of you, for attending. I believe that was the last slide speaking about the mental health. If there is any question in the chat, for me or to our seniors from the British Sudanese Association of Pediatric Child and Pediatric Health, please post it in the chat or raise your hand to speak up. And please, please, if you can honor me with your feedback, scan this code. This will only help and encourage and motivate for future lectures like this. Things like how to step up from an SHO to a Reg, and things more chatty, lectures like that. If you are interested and you feel that this lecture was helpful, please scan this code and let us know in order we can make more for you in the future. So I'm heading the mic back to you, Iman.
So first of all, thank you so much, Salma, for your participation in this event today. It's been of great help. Thank you for opening up your heart to us. Thank you for your all of valuable advice and experiences and sharing your tips and tricks. On a personal level, I've benefited a lot from that as well with your infectious positivity. So thank you, I think, on behalf of all of the participants today. The second thing, I would like to ask from the participant if they can fill the feedback for us, because the attendance certificates are linked to the feedback form as well. Expect them to be there within 2 weeks. I think there's one mic. There's one mic. I need to mute it. Sorry. There were the questions from Reem. Reem is asking. She said, "I have a questions for mothers. Do you think it's possible to be a new mom and have a job in the UK? Is it easy? I'm scared."
I will start with myself. Honestly, I was lucky to have the support from my partner to move here as a mom with my husband and my kids with me. But I have seen a lot of positive experiences from ladies who are coming here on their own, different social circumstances, and they are managing very beautifully and just fine. I would advise choose a workplace where there is a large support community of your own, and will help a lot of assessing, and plan in advance when you are accepting any job offer. Ask and try to reach out to people who work there to see if childminder is something easy or not. Another advice is to drive. My driving test is very soon, my practical test, so please pray for me. It's very, very, high advice that a mom will drive if she's alone, and this will, save her a lot of issues. It doesn't matter the age. I think the age for perspective of single mom has his own, pros and cons. Younger age is, maybe more difficult in the term of, childminder and stuff, but it's also easy for little kids to blend in the new community. However, older kids are, more easier to have childminder for. On the same time, it is a bit difficult to blend and cope to a new community. So there is really pros and cons for each age group. I cannot, say that is easy or that's difficult. But in general, if you're driving, if you have a support partner, if you plan and choose a workplace with a supportive community of your own, this will be also very benefit. And ask in the doctor social group, how is childminding in this area? And there is also websites that you can reach and see if it's easy to get a childminder in this area. And if anyone else wants to add. If anyone interested in any particular, a chat talk, so next lecture, please give us your feedback and suggest any topic. We can make similar lectures in the future based on how interest and how much feedback we get from this lecture. So please do participate. It's really important, and it will only, reflect on future lectures if this lecture was benefit or not. This is the only way to know is from your feedback today. So is it goodbye time already?
Hannah is saying, thank you so much for your inspiring. You are an inspiring person. I don't forget your lecture in the university, genetic. You are a superhero as always. Thank you again for the nice presentation.
Oh, thank you so much. Hannah is one of my colleagues in the university. Very nice to hear from you. And I'm so happy that you remember my very first public lecture. Thank you.
We've got still 3 minutes. If anyone wants to comment on anything or add anything, we're happy to hear you before wrapping up. And just for all of the participants, it's really hard to be in a new place and to have a new workplace. This is a very hard period. But just don't forget, all of us did it. And if we can do it, then you can do it. And there is a light at the end of the tunnel. So just believe in yourself and you can do it.
Thank you so much. Thank you so much, Iman and Poran and all of the bosses from the British Sudanese Association today. See you soon in upcoming lectures. And I think it's time to say sadly goodbye.
Yeah.
Bye, everyone.
So, thank you, everyone. See you soon.
Thank you. Bye-bye.